नमस्कार, दिस इज अतिंदम मुखर्जी और आप देख रहे हैं चाणक्यपुरी जंक्शन. We have Dr. Vishakha with us today, and we will be discussing about the skin problems and how we can get rid of skin problems by Ayurvedic treatment. Now, Dr. Vishakha, I'll just give a small brief about her. She is based in Goa, and she has been into this Ayurvedic treatment for many years now. Got patients from all over the world, and especially from the North India and Gujarat. So she will be discussing about different skin problems normally people have, and especially from Europe because the of the climate. We get a lot of Russian patients from Russia and Europe because of, as I had mentioned, the climate makes a lot of problem because for these skins. So she will discuss about these problems, why these problems happens first, and then the remedy for this, and then how you can get rid of those problems. Over to Dr. Vishakha now.
Namaste, Atindamji, and namaste to all the viewers.
Thank you.
Yeah. So now, if you see how Ayurveda looks at skin diseases, it is called as Kushtha in Ayurveda. Now, Kushtha, as we all would have thought, Kushtha was equated with leprosy in the past.
Right.
But in
Right.
Ayurveda, any kind of skin disease where there is discoloration of the skin, there is pigmentation, there's flakiness where the flakes are coming out. All of these can be categorized into under Kushtha. So Kushtha is one broad term for a different set of skin diseases or skin problems. Ayurveda has talked about 18 different types of Kushtha, in which there are
Oh,
two major subcategories, Mahakushtha and Kshudra Kushtha.
okay. What are
So,
they?
in Mahakushtha, usually the psoriasis comes under Mahakushtha, and it has
Okay.
been categorized under the types which are difficult to treat or they are little chronic in nature. So, the treatment, because even their expression is chronic in nature. It's not like today you consumed the causative factors and within 1 month you had something like psoriasis. So it's something that the pathogenesis has been occurring very silently inside your body for a pretty long duration. It could vary from like range between 6 months to 1 year, and then it
Oh,
starts showing the actual
results.
symptoms. So there
Okay.
could be certain signs also that the patient must be really not looking into. He is ignoring those symptoms, signs for a long time. So signs are something that are difficult to understand. And a Vaidya or an Ayurvedic practitioner would be easily able to, understand those because we have something called as Purva Rupa in Ayurveda where prodromal symptoms. You see
Okay.
something before the disease has fully manifested. So you
Okay.
see these tiny signs which maybe the patient may not be aware of that these could lead to disease, but a Vaidya would be able
Okay.
to understand. So simple thing like there's slight discoloration on the skin. The patient might see that there is just a little variation in his skin quality and the complexion has little kind of changed from his original. Now this does not mean that it has either whitened or it has darkened. Any kind of deviation from the normal for the patient is considered as abnormal basically. So
Okay.
it could be any of this. There could be discoloration which could be reddish, discoloration. It could be dark, blackish, it could be whitish discoloration. So all of this is considered under skin diseases. Now if you see the scope of Ayurveda in the treatment, we have to categorize these under Vataja, Pittaja and Kaphaja, and there could be
Okay.
combination of two doshas. So our treatment majorly revolves around understanding which dosha is firstly the predominant one in the kind of kusha that the patient is presenting us with, and then deciding the mode of treatment. So in Mahakushta, these subtypes that are under Mahakushta, majorly they are a little difficult to treat, which is why they are called as Mahakushta. They are a little difficult to treat.
I
So
understand.
you have to resort to certain panchakarma therapies which are called as shodhana. Shodhana means
Okay.
getting rid of the toxins or the body, the waste from the body by doing a major karma. So there are five different subtypes under panchakarma. So in Mahakushta, most of the times, if you see the mode of treatment, we have to resort the patient to a very strict dietary protocol again. I mean,
Mm-hmm.
Ayurveda just can't stop emphasizing enough on the dietary changes. Because if you see the
Okay.
positive factors of Kushta, it is a combination of different factors. The most important thing that we see it's very prevalent in today's world is mixing two entirely different categories of foods and having them.
Uh-huh.
Having
Okay.
having vegetables along with fruits, when you have this for a very long time, I'm sure this is really not known as much as it should be, but you're not supposed to mix two different categories of foods and have them for a long time. It's okay to have them once in a
Oh.
while. But when you
Oh.
mix vegetables like salads and fruits together, salads are majorly, they are vegetables, and fruits are
Okay.
basically fruits. They're two different categories. You're not supposed to mix them and have together, because
Okay.
different stomach acid is required to digest vegetables, different stomach acid is required to digest fruits. So when there is a
Mm-hmm.
combination of incompatible substances and there is consumption for a very long duration, and this is done by a person who does not exercise at all, he leads a sedentary lifestyle. Ayurveda
Okay.
says that a person who exercises enough can
Mm-hmm.
digest any kind of food. So you need to
Okay.
highlight that in exercise or no
Mm-hmm.
exercise is one of the major causes behind hampered metabolism, which could be the beginning of skin problems.
I'll just
So
ask one question. This exercise is it yoga can also be a part of this process?
yes, yes, absolutely. And I would consider all sorts of exercises under this. It is important to be
Mm-hmm.
physically active. And when I say physically active, just 1 hour of yoga in the morning is not enough. It is a 24/7 process. So you're supposed,
Okay.
there are so many factors, there are so many principles that each and every, your character, your conduct, everything needs to have yoga in it. It's not
Okay.
something
Okay.
that you
Okay.
get done in the morning and then you lead your life the way you want to throughout the day without any rules and regulations. Even if you're doing gym, just
Mm-hmm.
1 hour of gymming is not enough. And then throughout the day, you'll be seated in a cabin, air conditioned cabin with absolutely no movement. So even that
True.
could be, I mean, it is a problem area. So when you're talking about exercising, we basically talk about being physically active, almost through the day. So even if you're working in front of a PC, you have long screen time. Like I
True.
mentioned, you have to do something physically active every 1 hour or every 2 hours. So that counts under, being physically active. So physical activity could be like starting your day on a very active note and then taking breaks in between from your work and maybe just go for a little run. Just get exposed to sunlight a little bit. Throughout the day, you need at least 1 to 2 hours of sunlight. That keeps your skin very
True.
healthy, because Ayurveda considers twacha, that is skin, as the one of the most important tissues where everything that you eat shows on your skin. Everything that you consume, internally or
Very
externally,
true.
it shows on your skin.
Very true.
So
Very
skin
true.
exposure is extremely important to also boost the blood circulation, for also melanin to be secreted, because melanin, the more melanin you have, they say, the healthier your skin is. Okay, that's why fair people also have more chances of getting skin problems, lack of
True.
melanin. So that is the modern correlation. But in Ayurveda, the quality of your rakta dhatu or your blood tissue defines the skin health. So the cleaner your blood is, the more detoxified your blood is. That again plays, the liver again plays a role here. So the cleaner it is, the better your skin quality or skin health will be. So all of these things, everything that you eat shows up on the skin first. I mean, you see that sometimes you eat very oily foods and next day you have a pimple on your face,
Very
because
true. Very, very true. Yeah.
blood flows through every entity in your body. So whatever you eat First, the rasa dhatu is formed, then the rakta dhatu is formed. So the plasma forms and then the blood forms. So it's that quick. The formation of rakta dhatu is that quick. So everything you eat, it shows on your skin. So incompatible substances, eating very heavy foods together, eating raw and cooked foods together, all of these come under the causative factors behind skin problems, which is why we see a rise. Even a simple example that I can give from the current lifestyle that we are leading is having hot and cold foods, mixing them and having them together.
Oh,
One of the examples is sizzling brownie, something that's loved by everyone. So you have a hot
okay.
platter on which you have a hot brownie, and then you're pouring a cold ice cream on it. Or there is one scoop of ice cream.
Yeah.
So,
In fact, even
isn't this?
vanilla with hot chocolate sauce.
Yes. So, hot and cold taken together. Now, when it becomes a routine thing, when you are eating such things very regularly, let's say once a week, and this is continuing for years, you're bound to have some or the other kind of skin issues. There will be inflammation in your body. Then, like I said, raw and cooked foods mixed together. There are so many ways of eating salads these days. I see chickpeas and raw salads mixed together. Chickpeas are cooked foods, and then there are salads. Now, people who have a very strong agni or digestive strength can still tolerate these kind of foods which are not compatible, and the ones that exercise regularly. But people who are sedentary, they will see the repercussions of this immediately.
Okay.
So the rising cause behind this. Secondly, Ayurveda really emphasizes on the importance of regular bowel movements. You have to empty your bowels regularly, and it has to happen minimum once a day. And the ideal scenario, according to yogic science, is that it should happen twice a day. Once in the morning,
Mm-hmm.
and 12 hours later, you empty whatever you've had through the day. So when you're going to bed, again, you should be going on an empty stomach so that the detoxification happens without any, really no toxins in the system. Already you're emptying the bowels, and then whatever, microtoxins are left, that would be emptied or that would be cleansed during the course of the night. So the liver will be at its maximum, functional, or it will be optimally functioning between 10 to 2 at night. Now, if you're not
Okay.
asleep during this time, you are doing grave injustice to the liver, because you're
Oh.
staying awake and the whole body is now focused on keeping you awake rather than the
Mm-hmm.
body giving its best in cleansing the entire system. So if your liver is not given the rest, when you're sleeping at night, the liver is at rest, as in it gets the peace that it needs to do the detoxification. So 10 to 2 is the pitta time at night. So that
Okay.
is a time when your system is getting cleansed of the toxins of the entire day. That is why it is important to even get your night's sleep. You should ideally sleep by 10 to 10:30 p.m, and you should
Okay.
allow the body to detoxify and cleanse, because this could
Mm.
again lead to skin problems if you're not giving the required rest to the body. Then we have many other causative factors like eating more than your specific capacity. You must know how hungry you are, how good your appetite is, and then eat accordingly. So, quantity, quality of food, understanding that the body can tolerate certain kind of foods, eating in line with your prakriti. These are the most important key factors to keep yourself away from skin problems. And any kind of breaking these kind of rules and doing that for a pretty long time is one of the these are some of the causative factors behind skin problems. So now,
Wonderful.
if I
Now,
come to the treatment, or if you have any more questions,
I
maybe.
have one more question.
Yeah. Yes.
Now, especially in Central India, even Western India and North India, even in Eastern India, also all over, there are a lot of people are affected by dengue and chikungunya. So after the, I have seen, the after the treatment is over or they have been discharged from the hospitals, they get a lot of skin problems, rashes all over the body and
Right,
all that. So
right.
I'm sure that is because of this kind of steroid or medication is done because of that. So if you could speak little bit about the remedy of these problems also.
Right, right. So I'll have to I mean, I'll have to kind of explain a little bit about how jwara or fever functions. I mean, what it does to your body. So in Ayurveda, the diagnosis, we have like variety of jwara. There are dhatu gata jwaras. There are seven dhatus or tissues in the body. So each dhatu is prone to the toxins from the jwara. I mean, can enter each and every tissue, and it can cause or lead to specific symptoms related to that tissue. So Jwara is a very wide, I mean, you can talk about it for months together. There is so much literature available on Jwara or fever. It could come as a
Okay.
individual disease. It could come as a signs or a symptom of some other disease. So now, if the
Hmm.
Jwara has affected your twacha, if it has reached at the tissue level, that is a skin tissue level, then it will show some side effects on your skin. If it enters
Hmm.
the Rasa Dhatu, if it enters the Rakta Dhatu, these are the tissues that define your skin health. If your plasma or your Rasa is very good, there will be a beautiful lustre and radiance on the face of this particular person. Now, if the
Okay.
Rakta Dhatu is healthy, if he's following all everything that he needs to follow throughout the day, the dinacharya is being followed properly, having just enough water, not really too much, again in line with his prakriti and his lifestyle, then he will be blessed with good skin health. Now, first thing in Jwara, the most important thing that happens is there is complete derangement of the Agni. Agni is the power that helps you digest everything that you eat. So the
Okay.
food, the way it gets digested, it is dependent on the quality of your Agni or the power of your Agni, the capability of your Agni. So if the Agni is not good, which happens for sure 100% during Jwara, any patient down with fever, he is
Hmm.
not supposed to take medicines on the very first day, or at least in
Okay.
the unripe stage of fever, because the Agni is not capable of digesting absolutely anything, even the medicines. In fact, medicines are stronger than your food. So Ayurveda has advised complete langhana or alpa langhana. I mean, it can be eating very less or light food, light to digest food, or absolutely not eating at all. That is why you have one sign that there is complete lack of taste. There is no desire to eat
True.
food when you have fever. So your body is
Very true.
already telling you. Your body is already telling you that you're not supposed to eat because the body is busy fighting some pathogen or some microbes that it doesn't recognize. So it's already fighting that. So it needs to direct the entire army to the area where the pathogens have invaded. If you eat during this time, you are again calling that army to your stomach, and all of the focus now is on digesting the food rather than fighting the symptoms or the disease. So when you perform langhana, there is automatic autophagy, or there is the toxins that have entered the body, the debris from months or weeks is getting deactivated, or it's being cleansed. That is why fever is considered as a very good sign, actually, because if you have fever, it means you have an active immune system.
Okay.
Because jwara or
Okay.
fever is a sign of an active immune response. The body is trying to fight something. That's why it has increased the temperature. Now imagine when you don't understand this basic thing, that fever comes as a blessing to us unless it goes beyond 104 degrees. So till
Hmm.
103 degrees, you're good. And the chances of the fever rising are very less if you're following the light diet rule, or you're following the other rules that you're supposed to drink only and only boiled warm water when you get fever. You're not supposed to have
Okay.
anything cold even if you're feeling very hot from within. You're supposed to
Okay.
have warm boiled water. We have different medicated waters, Siddha Jala in Ayurveda, according to the dosha which has got affected. So one of the examples would be Guduchi Siddha Jala, Giloy, as we must have heard. during the pandemic.
Mm-hmm. Right, right,
So
right. Yes.
giloy is one of the very, very important herbs that we revere, we consider as sacred in Ayurveda. So we usually boil the giloy stem. If you have a fresh, you have a creeper at home, you boil the stem and then you have that water till your fever subsides. So this is very important to digest the toxins which have basically invaded your body. So when you have this water throughout the day, Guduchi is already also known to be Jwara Nashak. So it brings down the body temperature. It will bring down the temperature, it will regulate the temperature, and it will also make sure that the fever does not recur. There's no relapse. So if you follow the Langhana rule, if you follow the Laghu Ahara rule or the light diet rule, and you also have warm water through the day till complete recovery, the Jwara will not have any side effects. The toxins will be completely out of your system, which means when you have recovered, you have no side effects from that disease. So, when you treat the fever properly and scientifically, the chances of having side effects or new diseases become almost nil. So, that's what when I
Very
say
nice.
Shuddha
Okay.
Chikitsa according to Ayurveda, Shuddha Chikitsa is that Chikitsa which, when you're treating one disease, you do not see another disease taking
True,
birth.
true.
That's why scientifically treating Jwara is extremely important. It's something that commonly occurs. It's the most commonly occurring disease, Jwara or fever, and it is also the most misunderstood. So people have still not understood that fever is a good sign, diarrhea is a good sign. The body is trying to
Uh-huh.
detox something by itself. Vomiting is a
Okay.
good sign. When the body is
Mm-hmm.
not able to hold something, it will throw it out. So it's not
True,
scientific to hold it that time.
true.
You let the body do the detoxification. We've seen dogs also eating certain kinds of grass and then
True, very
vomiting
true. Yes, yes,
if they
yes,
have a
yes.
stomach upset. So that's how our human body is. It's a very simple thing to understand. But what we are trying to do here is we are loading the body with medicines when the body is not even able to digest something as basic as food. Even the lightest of foods have to be picked very wisely based on the strength of the agni. So this is why we see side effects after dengue and malaria because they are not treated properly. In our Ayurvedic practice, we don't see these side effects
Mm-hmm.
after treatment. So that's how it goes.
Very true. Wonderful, wonderful. Fine. So now, more or less, we have understood the causes of skin problems we have and other things. So, what we will do, maybe in our next session, we'll discuss about more problems. In fact, I was thinking of the remedies for the sports people. These
Hmm.
days we see a lot of activities. I mean, the athletes or whoever is into some sports, could be football or cricket or something. So we see on the TV that whenever they are injured, they come and spray something, or even after the injury, if it is more, then they go for some kind of treatment. So I'd like to discuss one day what is the remedy in Ayurveda for because this is a big segment. There are a lot of people they can't even play after some accident or whatever.
Yeah.
So, what could be the problems? This we'll discuss in the next session.
Sure.
This is today's session. I think people, whoever will see, they have understood what exactly we should do, and then we'll also share your contact details. They can contact you directly, and then take the benefit of it. Thank you so
Yeah.
much, Vishakha, and we'll keep discussing about more on Ayurvedic
Thank you.
treatments. Thank
Thank you.
you.
My
Namaste.
Namaste.